Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The working position for the operating team, as well as the positioning of the patient in the dental chair, has a profound impact on both comfort and efficiency. When the operator, dental assistant, patient, and equipment are positioned correctly, access to the oral cavity is improved and visibility is enhanced. Patient comfort and safety are also established. To better understand operator-patient positioning, let's divide the area around the patient into zones of activity. Imagine the patient's face as the face of a clock. The zones of activity are the operator zone, the transfer zone, the dental assistance zone, and the static zone. Within the operator zone, the dentist can gain access with excellent visibility by working in the 7 to 12 o'clock positions. The 11 o'clock position is considered to be the most universal and is used for working in most areas of the oral cavity. The 12 o'clock position is recommended when treating the maxillary and mandibular anterior teeth. Either the 7 or 9 o'clock positions may be used when treating the mandibular right and left quadrants, but only if the 11 o'clock position fails to provide favorable access. When utilizing the 9 o'clock position, the operator's legs form a V around the back corner of the patient's chair. The operator sits as close as possible to the patient and centers the area to be treated over the lap. When utilizing the 7 o'clock position, the operator sits with legs parallel to the patient's chair. The patient's head is turned toward or away from the operator as needed to improve access and visibility. The transfer zone is the area used to exchange all instruments and materials between the operator and the dental assistant. This also seems to be an ideal location for the dental unit, since all instruments are within easy reach of both members of the operating team. The dental assistance zone is located between the 2 and 4 o'clock position. Generally, the dental assistant is seated in the 3 o'clock position and remains in this position for all areas of the oral cavity. In this location, the assistant has access to the unit, instruments, and supplies. The static zone is an excellent location for the assistant's mobile cart. This places instruments and materials within easy reach of the assistant. The practice of four-handed dentistry involves more than just sitting down and treating the patient. The manner in which the dentist, dental assistant, and patient are seated is of the utmost importance. Let's examine the correct working position for the operator. Selection of a stable, well-cushioned operating stool is a prime factor in positioning the dentist. A back support is generally preferred for the operator since an abdominal support may interfere with access to the patient. A convenient hydraulic height adjustment is also helpful, especially if several dentists use the same operating stool. The operator is seated with feet flat on the floor. The seat is positioned low enough to allow the top of the thighs to be rather horizontal. Notice the oral cavity is centered in front of the dentist. A distance of 14 to 18 inches exists between the operator's eyes and the oral cavity. When in working position, the arms remain close to the body with forearms rather parallel to the floor. The upper body is upright and supported by the backrest of the stool. These relationships reduce fatigue and allow the dentist to work comfortably for long periods of time. The dental assistant's chair should be stable, well cushioned, and equipped with an adjustable abdominal support and footrest. Generally, 5 casters and a broad base provide the necessary stability. Height adjustment should be easily accessible. Adjusting the chair 4 to 6 inches higher than the operator provides better access to the oral cavity. The assistant's back should be upright with the stool adjusted to offer support just under the rib cage. The legs are positioned parallel with the upper portion of the patient's chair. The patient's chair should be comfortable with a thin, narrow back and convenient access to the controls. When seating the patient, adjust the height of the chair so the patient can be comfortably seated. The chair base should be raised slightly with the back reclined. It is helpful to raise the arm of the chair. To seat the patient, simply lower the arm of the chair and raise the base about 10 inches. Push the tilt button to place the patient in the half-tilt position. Lower the chair back slightly and pause a moment to give the patient an opportunity to adjust to this reclined position. Continue to lower the back of the chair until the patient is in a relatively flat or supine position. The patient is then lowered into the operator's lap. Final adjustments can be accomplished by having the patient's head turned toward or away from the operator, or by tilting the head up or down. It is important to always position the patient from the head down. The head should always be as close as possible to the upper end of the chair. The chair is narrow and thin in this area, and optimum access can be achieved. Successful four-handed dentistry requires teamwork by the operator and the assistant. Dental services can be delivered in a stress-free and comfortable manner when the basic elements of four-handed dentistry are practiced. By sharing the patient, good visibility is possible for both members of the operating team, and a higher quality of dental service is possible for the patient.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.